All right, thank you, Bruce. Tonight in Medical Rounds, breast cancer clinical trials are paving the way for patients to try new forms of treatments that can help doctors test alternative ways to diagnose and treat breast cancer. Now, to tell us more about some of these treatments is Dr. Wylie Hosmer, Medical Director of the Breast Program at the Hartford Healthcare Cancer Institute at the Hospital of Central Connecticut in New Britain. Good evening, Dr. Hosmer. Thanks for being with us tonight.
Good evening. Thanks so much for having me.
Well, we understand that the Hartford Hospital is a charter member of the Memorial Sloan Kettering Cancer Alliance, and this, of course, allows patients here in Connecticut to access hundreds of those clinical trials fairly close to home. Tell us now about some of these new approaches to treating breast cancer.
Yeah, there's never been a more exciting time to be involved in cancer clinical research. There's been really major advances with the use of immunotherapy, molecularly targeted treatment, and even the more intelligent use of older chemotherapy drugs. The goal of clinical research really remains to try and improve success and outcome for patients while hopefully cutting down on side effects and other toxicity from the treatment.
Well, I know that's good news for patients. Tell us about precision medicine and how you're able to target the cancer more precisely with, as you mentioned, the fewer side effects and less toxicity.
Yeah, it is now possible to do a more detailed genetic evaluation of an individual cancer, looking for weak spots in the cancer as compared to healthy cells in the body. And in many cases, we may have a drug available that really targets those weak spots, affecting the cancer much more than the healthy cells in the body, thereby achieving success with hopefully less side effects to the patient. Quite remarkable.
Now, what if someone is watching us right now, maybe a woman who has been diagnosed with breast cancer and is listening and saying, this sounds promising. How do I know if I could be eligible to participate in one of these clinical trials? What should she be thinking about?
Yeah, I think the key is to make sure that you express interest and bring it up with your physician. Your physician should be able to identify appropriate clinical trials available locally, regionally, or even in more distant locations. Additionally, the National Institute of Health maintains a website, clinicaltrials.gov, that lists every clinical trial happening at this time across the country.
Boy, that's great information. We thank you for that. And before we end the interview, I know certainly research and treatment have come a long way, but still, early detection is the best way to give patients a fighting chance, right? Mammograms, self-breast exams.
Yeah, absolutely. Mammogram remains the standard of care for detecting breast cancer early, and all of the major cancer societies still recommend routine mammogram for women. If we have the opportunity to diagnose a breast cancer at an earlier time point, we may be able to avoid chemotherapy or other more toxic treatments. So screening is key.
All right. Thank you so much, Dr. Hosmer, for sharing this valuable information with our viewers tonight, and keep up the great work you do there.